Hi everybody. So I've been putting off this video because I wanted to talk you through, and normally I say the good, the bad and the ugly of whatever situation, but it's hard to talk about or find good things that comes from some people's experience of going through chemotherapy, so it's probably more the bad and the ugly that you'll get from me today. I'm feeling a bit, I guess, fragile as well, so if there's tears, sorry about that. The reason I've been putting it off is I don't want to put anyone off going, if anyone finds themselves in the same situation as me where they have to make some decisions about whether they have to go through chemotherapy or not. I don't want my experience to put people off or influence their decision. And the main reason for that is because chemotherapy and how it impacts your body's very different for the individual, and obviously there's different types of drugs that have different kinds of side effects. So my experience is my experience and it shouldn't be a reflection of anybody else's. Some of the side effects that I'll mention you'll probably be aware of because they're very common, but I don't want you to get stuck on that these are side effects that everybody goes through, because based on the conversations I've had with other cancer patients, some of them haven't had some of the side effects that I've had, and there's been actually some that have been really, really unique to me as an individual. When I've asked oncology nurses, they've never come across a couple of the ones that I've gone through. So yeah, just to reiterate, my experience is very unique, and I think one of my theories for that is the drugs that form part of chemotherapy are toxic. They're basically a poison, and I do treat my body like a temple, especially since my operation. I went and did raw food diet for a number of days, and then I went vegan. I was exercising low impact almost every day. About a week after I got out of hospital, short walks, yoga to try and stretch out my abdomen, scarring. And as my mobility and energies come back, I've been able to get back on the bike and do some easier, more mobile sessions. So it's probably the healthiest I've ever been in my whole life. And then I went in from having a super clean system, physically, mentally, emotionally, to putting toxic drugs in my body. And my theory is, which has kind of come from a little bit of discussions with my doctors and so on, my theory is my body isn't used to dealing with all these toxins, and the reaction's been quite strong. So for people I was given the impression for people whose bodies are used to processing and having to digest lots of toxins like tobacco, alcohol, processed foods, fizzy drinks, people who don't do any exercise or don't look after their emotional or mental health, have a different experience because their body's used to trying to clear out these toxins all the time, whereas mine wasn't, especially in the 3 months before I started. So that's my theory anyway. So I've kind of had quite a hard time of it during my chemotherapy treatment, to be honest. I wanted to go through cycle 1 privately and myself so that I could understand what it would be like. I'm about day 4 into my cycle 2 of 4 cycles, and I thought it was about time that I shared some of the truth behind what the side effects are for me. So the most common one's tiredness, just especially in the first week. So my side effects, each cycle that I have is three weeks. I get IV on day 1, and then I'd have to take tablets for 2 weeks, and then I get 6 days off with no toxins going into my body. So the side effects for me tend to go into 3 parts, where I have part 1 typically lasts anything from 4 to 7 or 8 days. 4 days to say a week, and then I have another 10 days of still can feel the side effects, but they're not quite as bad. And then I think in the last cycle I only really had 2 days of feeling really good and feeling back to my old self before I had to go back again to the horrible phase. So for part 1 of it, basically the first week after the IV, I'm sleeping an extra sleep cycle every night, which is 90 minutes, and I typically have to take 2 naps during the day, one around lunchtime, depending on, you know, if I've been doing anything during the morning, and then I usually have to take one about 4 or 5 o'clock before dinner. Again, sometimes I'll actually sleep, other times I just have to shut my eyes and try and chill and focus on my breathing for half an hour, and relax and switch off. So, you know, when you add all those, that extra time of rest, you know, I'm probably talking about an extra 3 hours of rest and sleep, high quality rest every single day for the first week. I have had issues with nausea. They have given me anti-sickness, which kept sickness away, thankfully, but it didn't really have any impact on my appetite. I really don't have any appetite. Sometimes for the first cycle it was 4 or 5 days, and all the amazing healthy foods that I've been eating is what I managed to grow in terms of what I was able to eat, in terms of ideas and expanding my repertoire of vegan foods, suddenly shrunk because I've not been able to stomach a lot of different things. And there's another side effect which impacts what I can eat, which is anything that's cold impacts my hands. I get pins and needles really bad in the tips of my fingers. If I drink cold drinks, I get like a spasm down my throat. And it just means any drinks I have to have are warm, which fits in nicely with the ginger drink. But anyway, so I can't have anything cold. So although the fruit that I have in the house is room temperature, when it's a cold day, I can't even really eat that raw because the skin is cold. So I have to basically submerge my cut up fruit in warm water for a couple of minutes to heat it up, so that when I put it in my mouth, the taste doesn't change and it doesn't send my esophagus into spasm. If it's I cold and I'm exposed, then my hands go into like the claw. I can't physically move them, or if I can, it's I can't grip anything, or if I'm trying to do something pernickety, I physically can't do it. And certain foods give me a metallic taste in my mouth, which makes me just not want to eat. So basically for the first 4 or 5 days living on soup, fruit submerged in warm water, or or cooked fruit at night time, oat cakes, some oat bars like Stoats oats I seem to be able to stomach, or some of the Graze bars. Yeah, it's really difficult. I'm going to try some baked potato tonight, see how I get on with that. So those are the main ones. I also get the weird ones, which might give you a laugh. For the first week, when I take a bite of the first, whatever meal I'm eating, the first bite that I take, my jaw hinge goes into cramp. It disappears after a couple of seconds, but that's a weird one. And if I cry, you have muscles behind your eyeball, and if I cry, my eyeballs, the muscles behind my eyeball ache, like it's like a mini cramp. So when I was getting a bit upset 5 minutes ago and I went like this, that was because my eyeballs were aching. So yeah, that's the summary. You know, it's difficult in the first week. I pretty much think I can't do any of the future cycles because it's just a misery. I think the hand thing is really difficult because I'm a very practical person that likes to be moving, and the cold, being outside and the cold temperatures just now means it's very difficult for me to do that. And also I've had socials kind of set up, but one of the side effects, which I'll talk to you about in a future video, is your white blood cell count reduces certain parts of it, so your immune system's down. So I've had some socials which are really important for me. Walks with friends and family cancelled because people have been ill, so it's quite a lonely time when the social interaction's important, but people don't want to expose you to infection. So it's hard going, I'm not gonna lie, but it's hard going for me because of how my body's reacted. So at the moment, when I'm having a bad day, I try and focus on the love that's coming my way and the thoughts from friends and family and colleagues that I've known over the years. And I'm pushing through the harder hours and days for them and for Stacey and for our future together and for whatever we end up doing together. So rather than trying to focus on the side effects, which is a hard thing to do because it's right in front of your face, and with the restrictions we still can't see many people that are close to me but they're in a different region. So yeah, so that's it. Sorry it wasn't more positive today, but that's the bad and the ugly of my chemotherapy so far. I will do my best to try and make it through the 4 cycles, and looking forward to having an amazing second half of the year when I'm feeling far more energetic and able to get on with life, even as a stoma patient, for another 6 or 8 months until that reversal happens. So anyway, this video's gone on long enough. I'll be back tomorrow with a bit more of a fun, got a cool story for you that's from my work days at OVO Energy, from Harry Palmer, Helen Green and the rest of the team on Is the Juice Worth the Squeeze? I'll leave you with that teaser and I'll tell you about it tomorrow.